It's one of the most common forms of heart disease. We're talking today about heart failure with Dr. Salpy Pamboukian. Thank you so much for joining us.
Thank you for having me.
From UAB, and you're a cardiologist. The thing I think that's encouraging about heart failure, even though it's so common, is that this a lot of times is dependent on our lifestyle. So we can make simple changes, right?
Absolutely. In general, with heart disease, it's very important to follow a healthy lifestyle. That's going to include having a healthy diet, avoiding salt intake, sometimes limiting your fluid intake, and exercising to control your weight.
Okay, there's two different types of heart failure. Can you explain those to us?
Yeah, there's two different phases of heart function. One is the squeezing or emptying phase, and that's called systole, and there's a relaxing or filling phase, and that's called diastole. So heart failure really refers to the fact that the heart's not able to circulate the blood adequately in the body. And that can be because there's an abnormality of one or both of those phases of heart function.
Okay, so either the heart is more rigid, is that correct?
Yes, the heart.
Or it's not completely squeezing the blood out.
That's absolutely right. So when the heart becomes rigid and stiff over time, it can't relax properly. Blood cannot flow into the heart normally for the next heartbeat, and it'll back up on the lungs and cause symptoms.
What are some of those warning signs or symptoms?
Well, the most common one is shortness of breath, because there is a fluid or blood backup into the lungs. There can also be swelling in the abdomen or in the ankles. If there's not enough blood flow out to the body, people may feel tired. Doing daily activities, including bathing and dressing, may become challenging. And then there may be evidence of organ dysfunction, including kidney or liver dysfunction.
But they wouldn't feel any actual symptoms in their heart, like an arrhythmia, is that correct?
Sometimes they might. So in fact, sometimes chest pain or chest tightness may be the presentation, palpitations, dizziness, or even passing out.
So any of those things, they certainly need to see their primary care physician at the very least, but definitely a cardiologist as well.
Absolutely, because you know some of those symptoms may indicate other problems with the lungs, for example. So it's really your doctor's job to try and sort out whether it's a heart problem or related to something else.
But again, the good news is you can help someone get back on track with medication, right, would be first and foremost, but then also a change in their lifestyle.
Absolutely. So there's a whole series of medications, a cocktail of medications that are prescribed for this condition that can help to improve how you feel and also your survival.
We want people to know also that UAB is just a great resource, and you can actually easily from your own home go to their website, which is uabheartbeat.org, and there's so many resources on that website, including this great cookbook.
Absolutely. You can also go on there and assess your risk for heart disease, and then if you would like to make an appointment with a UAB physician, for example in the heart failure clinic, you can do so at the website as well.
And then again, this is the UAB Heart Healthy Cookbook. Whether or not you think you may have heart problems, definitely something that we should all consider to get on a good plan, a nutritional plan, and then that exercise
Absolutely,
as well.
That's very important.
All right, Dr. Salpy Pamboukian from UAB, thank you so much. We really appreciate these tips for us.
It's been my pleasure. Thank you.
All right, and again, you can go to that website, which is uabheartbeat.org, to learn more information. Some very important tips there, and it's also good to know that UAB is actually the only center in the state that offers heart transplants or VADs, which is the mechanical heart pump that's actually surgically implanted. So it's good to know they're a great resource right here in our town.
Next to those great doctors are great nurses. Those great nurses get hands-on training at Virginia College. We'll show you that when Daytime Alabama continues.